हेलो एवरीवन, सो वेलकम बैक टू माय चैनल नर्सिंग की। आज का हमारा टॉपिक है मस्कुलोस्केलेटल सिस्टम। इसमें हम एनाटॉमी एंड फिजियोलॉजी देखेंगे हमारे मस्कुलोस्केलेटल सिस्टम की। मस्कुलोस्केलेटल सिस्टम एक बेसिक टॉपिक है, तो हम इसमें स्टडी करेंगे एनाटॉमी एंड फिजियोलॉजी। सो लेट्स स्टार्ट विद आवर टॉपिक फर्स्ट। So anatomy and physiology of musculoskeletal system. So the A part is anterior view of skeletal system and the B one is the posterior view of skeletal system. So skeletal system mainly consists of the axial skeleton and appendicular skeleton that we will see in the next slide. There are 206 bones in human body. Among 206 bones, 80 bones are the part of axial skeleton which compose skull, vertebral column and thorax. And 126 bones are the part of appendicular skeleton system. So appendicular skeleton comprises the upper and lower limbs, the pectoral and pelvic girdle. This set of amazing skeleton framework support our weight and limbs, protects our body's organs, provides attachment for muscles and participates in our respiration. So we'll talk about the axial skeleton. In axial skeleton, skull provides structure to your head and face while also protecting your brain. The bones in your skull can be divided into the cranial bones which form your cranium. So there are mainly 8 cranial bones. One is frontal bone, 2 parietal bones, 2 temporal bones, 1 occipital bone, 1 ethmoid bone and 1 sphenoid bone. So main function of cranium is to protect the brain while includes the cerebellum, cerebrum and brain stem. It also gives a surface for facial muscle to attach to the cranium, isn't involved with any sort of movement or activity. So in facial bones, it mainly provide for muscle attachment, facial expressions, eating of food, help to separate nasal and oral cavities, house the sinuses and to protect the entrances to the digestive and respiratory system. So mainly total number of facial bones are 14. Zygomatic bone 2, 2 maxilla bones, 2 nasal bones, 2 lacrimal bones, 1 vomer bone, 2 palatine bones, 2 inferior nasal concave and 1 mandible. So next one is hyoid bone. It supports the larynx and is attachment point for the tongue and muscles of the larynx and pharynx. The hyoid bone plays an important part in our speech. The greater horn support the larynx and is the best attached to the tongue. The lesser horns are attached to the styloid ligaments. So in this picture you can see both the anterior and lateral view of hyoid bone. In anterior view there is a greater horn in right side and the lesser horn in left side, and in lateral view you can see the body of the hyoid bone. So mainly this hyoid bone plays an important part in our speech. The auditory ossicles. So they are mainly 6 auditory ossicles and are located in cavity within the temporal bone. So mainly if we will talk about the auditory ossicles, so in the middle ear mainly they contain these 3 tiny ear bones. So these are called the auditory ossicle. So you can see in the next picture. So you can see there are mainly 3 bones. In left side it is malleus and in right side the upper one is the incus and the lower one is the stapes. The malleus is also called as hammer, the incus also called the anvil and the stapes is also known as stirrup. And the stapes is the smallest bone that is mainly present in the middle ear. And yeah, you have to remember they are on each side, so that's why they are totally 6 auditory ossicles. Rib cage. 25 total bones are present in rib cage. One is sternum and the 24 are ribs. Sternum is partially T-shaped vertical bone that forms the anterior portion of the chest wall centrally. The sternum is divided anatomically into three segments: manubrium, body, and xiphoid process. The sternum connects the ribs via the costal cartilage forming the anterior rib cage. Sternum is mainly a bony breastbone and its movement are important in respiration. So if we will talk about the ribs, the 24 ribs originate between the thoracic vertebrae and end in the wall of the thoracic cavity. Ribs 1 to 7 are called true ribs and ribs 8 to 12 are called false ribs. Since they do not attach directly to the sternum, the last two pair of the ribs, 11th and 12th, are called floating ribs because they have no connection with the sternum or vertebral ribs. So this thoracic cage and ribs protect the heart, lung, thymus and other structures. It serves as attachment for the muscle involved in respiration, position of the vertebral column and movements of the pectoral girdle and upper limbs. Vertebral column. Vertebral column is made up of four spinal curves. First one is the cervical curve. The cervical curve which balances the weight of our head and our neck. Second one is thoracic curve which accommodate the thoracic organs. Next is lumbar curve which balance the weight of our trunk over our lower limbs and assist in our standing. The fourth one is sacral curve which accommodates the abdominopelvic organs. In vertebral column, it mainly consists of 24 vertebra, 1 sacrum and 1 coccyx. So total vertebra is 26 bones. Mainly it consists 26 bones. In cervical vertebra C1 to C7 consisting of the atlas C1 and the axis C2 which constitute the neck and attaches to the thoracic vertebra. The thoracic T1 to T12 consisting of the ribs and costal and transverse costal facets. Lumbar L1 to L5 which articulates with the sacrum which articulates with the coccyx. Appendicular skeleton is the portion of the skeleton of vertebrae consisting of the bones that support the appendages. There are 126 bones. The appendicular skeleton includes the skeletal elements within the limbs as well as supporting shoulder girdle and pelvic girdle. Shoulder girdle is also known as pectoral girdle. So pectoral girdle attaches to the upper limbs and consists of the clavicle and scapula. Movements of the clavicle and scapula position the shoulder joints and provide a base for arm movement. The surface of the scapula and clavicle are important sites for muscle attachment. So you can see the front view of shoulder girdle. At your left side you can see the scapula and clavicle. So there are mainly two shoulders and two clavicle. Next is upper extremity. It mainly consists 60 bones. The upper limbs are made up of the arms, forearms, wrists and hands. In upper extremity, the first one is humerus. This limb extends from the scapula to the elbow. The arm bone articulates with the shoulder joint known as the glenohumeral joint. The ulna, it lies medial to the radius. And the radius is the lateral bone of the forearm. The disc-shaped radial head articulates with the capitulum of the humerus. And the carpus, it mainly contains 8 carpal bones. The metacarpals and phalanges. The metacarpal bones have 5 bones that articulate with the distal carpal bones and give the hand support. Each hand has 14 phalanges, that is also known as finger bones. And the next one is pelvic girdle. Pelvic girdle is the attachment site for the lower limbs. It must withstand the stresses of bearing weight and of movement. Pelvic girdle mainly consists of 2 innominate bones, that is pelvic bone and coxal bone. Next is lower limb. The lower limbs are designed to movement and support. The lower limb consists of femur, patella, tibia, fibula, tarsal bones. Lower extremity mainly consists of 60 bones. The femur consists of femoral head, which articulate with the pelvis. A ligament attaches it at the acetabulum to the femur at the fovea capitis. It has a neck shaft, greater and lesser trochanters, intertrochanteric line and line aspera. Next is patella. Patella is also known as kneecap, glides across the patellar surface of the femur. It is a sesamoid bone that forms within tendons and extends to the knees. The tibia or shin bone is one of our weight bearing bones. It is a large medial bone of the leg, and the fibula is a slender bone parallel the lateral border of the tibia. The fibula does not help transfer weight to the ankle and foot. It is however an important site for attachment of the muscle that move the foot and the ankle joint. The tarsal bones, the ankle or tarsus consist of 7 tarsal bones. The metatarsal and phalanges. Metatarsal bones are 5 long bones that form the distal portion of the foot and metatarsus. The phalanges or toes have the same organization as the fingers. The toes contain 14 phalanges. So that's all about the topic. Thanks for watching my video. Please like, share and subscribe my video. See you soon. Bye bye.